Thanks for watching. This is YouTube Medical University. This time it's about lymphoma. Are you familiar with the disease called lymphoma? It's a type of blood cancer that affects as many as 35,000 people each year. It's a type of blood cancer. The number of patients has nearly doubled in the 15 years since 2000, although it's not very well known. Actually, among blood cancers, malignant lymphoma is the most common. Have you ever had the experience of noticing a lump in your neck while massaging your lymph nodes? A slight swelling of the lymph nodes can be an early symptom of lymphoma. And another characteristic of lymphoma is that it has many other unexpected symptoms that are hard to notice. As a doctor, I often think while seeing patients, if only I had known earlier that this symptom indicated lymphoma. I've also had cases where patients were referred to me with unexplained symptoms, and after a thorough examination, it turned out to be malignant lymphoma. Malignant lymphoma. When people hear it's a blood cancer, many imagine it as an incurable disease, but actually, treatment methods for lymphoma are being established more and more, and the chances of recovery are increasing every year. Freelance announcer Shinsuke Kasai was diagnosed with stage 4 malignant lymphoma, but after overcoming treatments like chemotherapy, he is still active today. So in this video, in the first part, we'll explain what lymph actually is. We'll clearly explain lymph, which seems familiar, but is actually hard to understand. In the second part, we'll introduce 4 unexpected warning signs of lymphoma that you've been waiting for. In the third part, we'll briefly explain the methods for testing and treating lymphoma, and at the end we'll also talk about an important way to prevent certain types of lymphoma. I'd be happy if you watch until the end. Here at YouTube Medical University, we share easy to understand and enjoyable videos from a doctor's perspective to help you become healthier starting tomorrow. So please subscribe to the channel so you don't miss any new videos. Now then, in the first part, I'll clearly explain what exactly lymph is. If you're thinking, that's fine, but I want to know the early symptoms right away, feel free to skip ahead and start watching from the second part. Lymph refers to the lymphatic vessels, which are tubes that run throughout the body similar to blood vessels. Various substances pass through these lymphatic vessels, such as fats absorbed from the body, plasma that has seeped out from the blood, and waste products. Please take a look at this image. This is called lymphedema, a condition where the lymphatic vessels become blocked and the leg suddenly swells up like an elephant's. This happens because the lymph fluid stagnates due to the blockage of the lymphatic vessels. The space between our blood vessels and cells is filled with tissue fluid. Some of this tissue fluid is reabsorbed and collected back into the blood vessels, but not all of it can be recovered. The lymphatic system also plays a role in collecting this excess tissue fluid. Sometimes we get infected by viruses or bacteria. In such cases, these viruses or bacteria can also flow into the lymphatic vessels. However, this is actually what the lymphatic system intends. In fact, there are checkpoints called lymph nodes inside the lymphatic vessels. Inside these lymph nodes, immune cells called lymphocytes are waiting. It might be easier to understand if you think of the lymph nodes as checkpoints that catch viruses and bacteria to eliminate germs. When you catch a cold, you may have experienced your lymph nodes swelling. This is proof that your lymph nodes are fighting off the germs. What do you think? I believe it's easier to remember if you understand the reason behind it. And these lymph nodes serve as checkpoints. When there are cancer cells in the body and those cancer cells enter the bloodstream, some of them can leak out of the blood and get caught in the lymph nodes. This is called lymph node metastasis. You may have often heard that cancer has spread to the lymph nodes, and this can be thought of as the cancer cells being caught at the checkpoint known as the lymph node. In other words, if there is lymph node metastasis of cancer, it means that cancer cells have already entered the bloodstream, which indicates distant metastasis and makes treatment more difficult. What do you think? We often talk about lymph nodes in general terms, but I think it's easier to understand if you think about it this way. Let's proceed to what you've been anticipating. In the second part, I'll introduce 4 unexpected signs of lymphoma. Before that, let me share some general information about who is more likely to develop malignant lymphoma. Malignant lymphoma can affect young people, but is most prevalent in those in their 70s, with risk increasing with age. Regarding gender ratio, It is said that it is slightly more common in men. Surprisingly, the cause of most malignant lymphomas is unknown. It is believed that genetic mutations cause abnormal increases in the lifespan of lymphocytes, which are responsible for immunity, and this may lead to cancer. Many people think that terminal cancer is associated with severe pain, but the swelling of lymph nodes in malignant lymphoma is usually not painful. In fact, if there is a sensation of heat or pain when pressing on the swollen lymph nodes, it suggests an infection by bacteria, which actually lowers the likelihood of malignant lymphoma. Since it doesn't hurt, some people think it's okay to leave it alone and end up putting off going to the hospital, only to find out later that it has progressed without them noticing. So please don't underestimate a painless lump in your neck. Also, when it comes to a lump in the neck caused by malignant lymphoma, please remember another important characteristic besides the lack of pain. That is, it tends to get bigger over time. If you notice that a lump that wasn't there yesterday suddenly gets bigger, it's often due to a bacterial infection. However, if you feel that your lymph nodes are gradually and slowly getting larger over 2 weeks, 3 weeks, a month, or even 2 months, you should suspect malignant lymphoma. In the case of a bacterial infection, even if the lump gets bigger as the infection heals, the lymph nodes will shrink. However, in the case of malignant lymphoma, the lymph nodes do not get smaller. So if you are concerned about a lump in your lymph nodes, it's very important to regularly feel the area, remember the size, and check for yourself whether it is getting bigger. For example, if you have a lymph node lump that's about 1.5 centimeters and it doesn't get any smaller after a month, or it might even be getting a little bigger, there is a possibility of malignant lymphoma. In such cases, please make sure to see your regular doctor or a hematologist. And the second of the 4 unexpected signs of malignant lymphoma is night sweats. I think most people wouldn't associate cancer with night sweats, would they? Actually, malignant lymphoma has what's called B symptoms in medical terms, and one of its characteristics is sweating a lot while sleeping at night. It's not just feeling a little uncomfortable and sweating a bit, it's sweating so much that you're drenched. If you sweat so much that you have to change your pajamas or sheets, you fit this symptom. You might think, I've been sweating a lot lately, but maybe it's just the change of seasons, or maybe it's menopause. If you just ignore it like that, it could actually be a symptom of malignant lymphoma. So, if you have this symptom along with any of the other symptoms I'll introduce, please consider consulting a hospital. Here are 4 unexpected signs of malignant lymphoma. The third one is unexplained fever. Unexplained fever means a fever where the cause can't be identified even after investigation. Actually, it's common to have a slight fever when you have cancer, but with malignant lymphoma, you can sometimes have a fever over 38 degrees Celsius. And in the early stages of malignant lymphoma, fever might be the only symptom. If lymph nodes are not palpable, the fever may be unexplained. In the worst case, you might not get a diagnosis even after visiting multiple hospitals. I've actually examined patients like that myself. After taking a detailed medical history and running tests, it turned out that the patient actually had malignant lymphoma. Cancer cells absorb nutrients from the body, grow larger, and cause inflammation themselves. This can lead to fever and excessive sweating, which are easy to remember. And please also remember the last symptom. Here is the 4th surprising sign of malignant lymphoma: weight loss. If you've recently been sweating a lot and losing weight, you might think your metabolism has improved, but it's dangerous to just ignore it and think you're lucky to be losing weight. Malignant tumors deprive your body of nutrients, causing weight loss regardless of food intake. As the condition worsens, fatigue sets in and eating becomes difficult, leading to further weight loss. Here are guidelines for significant weight loss. If you've lost more than 10% of your body weight in 6 months, that could be considered pathological weight loss. For example, if someone who weighs 60 kilograms loses 6 kilograms over 6 months and drops to 54 kilograms, that could be considered abnormal weight loss. Of course, if you're intentionally dieting and lose 10% of your weight in 6 months, that's fine, but if you're not trying to diet, and your weight keeps dropping, we suspect malignant lymphoma, and there is also the possibility of other cancers. I highly recommend weighing yourself regularly and consulting your primary doctor if you notice anything unusual. Now let's review what we covered in the first and second periods. First, lymph refers to the body's waste products, and fat, as well as viruses and bacteria, are collected, and along the way there are checkpoints called lymph nodes. I explained that these are very important structures for the body's immune system. And in the second period, I introduced 4 unexpected signs of malignant lymphoma. Lumps in the body, especially those that are painless and gradually increase in size, night sweats, unexplained fever, and weight loss. So in the third period, I will explain the tests that are done when malignant lymphoma is suspected, the treatments if it is diagnosed, and whether there are any ways to prevent malignant lymphoma in the first place. At YouTube Medical University, we share data-driven videos from a doctor's perspective, taking responsibility for the information provided. Please rely on at least one credible source. It's very important to have one. If you don't mind, subscribing to the channel so you don't miss new videos would really encourage us. Now let's move on to the third period. Now I'll give a brief explanation about the tests for malignant lymphoma. First, malignant lymphoma is often found by chance when taking an X-ray. So what kind of tests are actually done when a lymph node is swollen? In that case, a test called a biopsy is performed where the lymph node or tumor suspected to be the cause is directly removed and examined under a microscope to check for the presence of malignant tumors. In a biopsy, chromosomal analysis and genetic testing of the tissue may also be done. And since malignant lymphoma is a cancer of the blood tests may show changes in the number of cells that work in the blood, such as white blood cells, red blood cells, and platelets. Therefore, these blood test values are also taken into consideration when determining whether the possibility of malignant lymphoma is high or low. And when it is not clear where the malignant lymphoma is actually located, it is common to perform imaging tests such as computed tomography or positron emission tomography scans, which can examine the entire body, and sometimes magnetic resonance imaging scans. And if a full body examination reveals malignant lymphoma, staging will be performed to determine what stage it is in, and the appropriate treatment will be selected. In the case of malignant lymphoma, there are 3 main types of treatment: chemotherapy, radiation therapy, and hematopoietic stem cell transplantation. Chemotherapy can sometimes be administered on an outpatient basis if the patient is in good condition. Radiation therapy may be used together with chemotherapy, or if the lymphoma becomes large and causes pain, radiation therapy may also be used to help relieve that pain. If other treatments fail, hematopoietic stem cell transplantation, a type of transplant, may be an option. The treatment will vary depending on the stage, physical strength, and risk factors, so the specific treatment plan will be decided in consultation with a hematologist. And finally, thank you for waiting. Early detection of malignant lymphoma is important, but from the perspective of preventing disease before it develops, it's also crucial to reduce the risk before cancer occurs. For certain types of malignant lymphoma, there are actually effective preventive measures. Mucosa-associated lymphoid tissue lymphoma is a type of tumor that develops in the stomach. The trigger for this lymphoma is, it's Helicobacter pylori. Helicobacter pylori is the only bacterium that can survive in the stomach, and I've explained many times in past videos that this bacterium can cause stomach cancer. In fact, this Helicobacter pylori can also cause lymphoma in the stomach. Data shows up to 90% of people with gastric mucosa-associated lymphoid tissue lymphoma were infected with Helicobacter pylori. The reason for this is quite simple. When Helicobacter pylori is present in the stomach, it causes gastritis, and the stomach lining becomes thinner, making it unable to produce stomach acid, which has a sterilizing effect. This changes the environment inside the stomach, and as the immune system becomes more active to eliminate the Helicobacter pylori, lymphatic activity increases, which is believed to lead to the development of gastric mucosa-associated lymphoid tissue lymphoma. I think it's easier to understand when you consider the reason. As for this Helicobacter pylori, by taking antibiotics for a week, about 90% of people can eliminate the bacteria. And it's said that if you can eliminate it early while you're still young, you can prevent about 100% of stomach cancers. Eliminating Helicobacter pylori is extremely important. I've explained this in a previous video, so please check out the video from the description after this. How was it? This time, we're talking about warning signs of malignant lymphoma. So what exactly are lymph nodes in the first place? Please be sure to check it out.